This 70-year-old gentleman who is coming to us with complaints of back pain and inability to move both lower limbs. So we examined the patient. Patient has progressive weakness for both lower limbs for last 3 years. Now presently the power has become 0 to 1 by 5. And there's severe back pain for which patient came to us. We investigated and found there are flow voids in the MRI, and we did an angio. The angio is showing a very rare disorder which is called arteriovenous fistula of the filum terminale. So this arteriovenous fistulae of the filum terminale is a rare condition. Basically it is supplied by the anterospinal artery. It's a single artery, single vein, single hole fistula, and there is a lot of venous stress, venous pressure on the spinal cord, which causes all this edema and this weakness of lower limbs, bladder bowel symptoms and back pain. So we are going to treat this patient by embolization today. Thank you. So now this is the spinal angiogram, which is demonstrating the anterospinal artery going all the way down and terminating as the arteriovenous fistulae. We can see that very well, and this is at the level of L4, L5. If you just look at the non-DSA picture, we can see that the ASA is coming all the way down, and this is forming the fistula. It's supplied by ASA and the fistulae, and then it goes through a vein. So let's look at this anatomy. Now this is basically the anterospinal artery. We can see that anterospinal artery over here is coming down all the way, and then the change of caliber, which is the site of fistulae, and then this progresses as the bunch of veins, and then that goes all the way into the filum terminale, and the vein will go up as we see the progression of the angiogram. So this is the origin of the vein, which is going all the way up. So the thick one. So let's review the angiogram again at the start of the anterospinal artery and the fistulae and the vein. So this is how it looks like. So our target is to treat this arteriovenous fistulae by glue embolization. So we started the embolization with cannulating the intercostal artery on the left side where the ASA is coming out of at the level of D12, D11, D12, and ASA is going down. So we choose to go with a magic 1.2 French catheter, microcatheter, with a hybrid 070 wire. So we can see this super selective microcatheter angiogram. Our microcatheter tip is over here, and we are doing an angiogram, and the angiogram is demonstrating there is the AV fistula, and we have reached the site of this final filum terminale arteriovenous fistulae, and we are going to embolize with 16% glue over here. So this is exactly the position where I have withdrawn the catheter by 1 centimeter away from the fistula, because the glue is going to be progressively going forward. So it's good to be proximal to the fistulae, and I came back about centimeter proximal to the fistulae, and then I will inject the 16% glue with lipidol over here in this fistula. So we can see the beautiful glue cast. It says 16% glue with lipidol. We can see exactly this is the arterial portion of the fistula, and this is exactly the fistula, and this is the glue into the venous pouch. So always the idea of treating a fistula is that you should be able to take about a centimeter from the fistulae, a centimeter from the vein and the fistula, and a centimeter from the artery, and that gives us the complete cure, which we have achieved here very nicely. And obviously once we do the check angio, we see that the fistula is no more filling at all. So that's a beautiful demonstration of a complete cure of filum terminale arteriovenous fistulae. We can see that there is no flow whatsoever. This is the site of the glue, and we have given quite a forceful injection to see that there is no more fistulae filling, and the glue cast is intactly seen. Thank you very much. Thank you.